In Oklahoma, we have now nearly 18,000 cases in total. About 10% of these individuals have been hospitalized, and somewhere around 20 to 25% of those who are hospitalized are deceased. In the last 2 weeks, we are regularly setting records for numbers of new cases and numbers of new hospitalizations. Although the largest increases in the incidence of COVID-19 in Oklahoma have been in individuals in the 15 to 54-year age group, we are now also seeing substantial increases in individuals over the age of 65. This is important to note because it's these folks, the older folks, who are at the highest risk of having a poor outcome, and it indicates that we need to do a better job of protecting these individuals. Right, so we are doing much more testing than we were several months ago, and indeed we are picking up more new cases, in part because of the new testing. But as you look at the numbers of new tests, we also see a higher percentage of those tests are also positive. And it depends on how you look at your numbers, if you look at over 5-day periods or 7-day periods of time. But we are seeing substantial increases in the percentage of positive cases. And this is not just a reflection of more testing, it is indeed a reflection of more transmission in the community. My recollection from the data is that we saw the biggest increase, or the first really big bump in the incidence of infection the week around June 12th to June 18th. What was happening before that, I don't really recall. I think we were just getting out and about more, and people were enjoying the increased lack of restrictions and increased mobility. On average, I think the State Health Department reports that it's about 3 days from onset of symptom to the report of a positive case, or the obtaining of the specimen. And if it takes on average 5 days for somebody to develop symptoms from when they were infected, that gives about a week. So anywhere from a week to 10 days before that. So starting at the Memorial Day weekend and thereafter would be sort of a time that you could see increased transmission. And then we don't see the numbers go up for another 10 days or so. If you are infected, say this morning, and when I say infected, if you're exposed to somebody who has disease, and let's say 5 days from now you become sick, and we know this is when you got it. So if we know that was when infected, if you were infected this morning and tested this afternoon, chances are you would be negative. You probably don't develop a positive test until about 2 to 3 days after you're infected, because it takes time for the virus to replicate and build up enough numbers for the test to detect. You need to do to slow transmission, and in a sense flatten that curve, is indeed wear masks whenever possible and when reasonable and practical. If I'm out taking a walk by myself and there's nobody else around, my wearing a mask doesn't help me, it doesn't help anybody else. That said, if I'm in a crowd, if I'm walking with a group of people, then wearing a mask in that setting would be reasonable and would help prevent spread. Also depends on the kind of a mask that you're wearing. So, and even if the mask isn't one that may protect you, it still may to some degree decrease the amount of spit and things that go in the air. And remember, much of this is you're reducing chances, it's probability. You're changing a probability from say 50 to 70% to maybe 20 to 30%.